The scene you just saw was a common event before the development of modern personal protective equipment, or PPE. Well, maybe a little on the dramatic side, but you get the point. In the early 1900s, masks were made up of a single layer of gauze, and gloves, if worn, were made of sheep intestines. PPE was only recommended but not enforced, and as a result, bacteria and viruses were able to spread throughout hospitals at an alarming rate, causing staff and patient illness. By the 1970s, the Centers for Disease Control and Prevention had set out 7 colored categories for isolation precautions for the patient depending on their infection. These included strict, respiratory, protective, enteric, wound and skin, discharge, and blood. With more research surrounding the transmission of infectious organisms, the CDC introduced recommendations in 1985 that healthcare workers should wear personal protective equipment to protect themselves. Hand washing became immediately recommended after glove removal. With the outbreak of SARS, HIV, and Ebola, a surge of new research went into stricter regulation of PPE. Research supporting that PPEs reduce the spread of infection and the incidence of hospital-acquired infections led to a change in the practice of healthcare workers. Here in Alberta, Alberta Health Services bases their policies and procedures on evidence from the World Health Organization, Centers for Disease Control and Prevention, and the Public Health Agency of Canada, which shows the most effective way to use PPE in a healthcare setting to prevent transmission of infectious organisms. This research informs best practice in a healthcare setting and has led to a reduction in the spread of infectious microorganisms. All of their findings have been summarized into Best Practice Guidelines Manual for Infection Prevention and Control. The 5 main categories for isolation precautions today are contact, droplet, airborne, contact and droplet, and airborne and contact. With research surrounding emerging microorganisms such as MRSA, we are able to manipulate the environment to not only prevent spread of infection, but also prevent further contamination of the patient with infections from the hospital environment. Due to the nature of MRSA, many hospitals such as South Health Campus and Peter Lahey perform MRSA screening for any patient being admitted to the hospital to be able to isolate a patient before the chance of infection. Even though PPE is regulated and enforced, there are still flaws with the system, as many healthcare professionals do not adhere to the appropriate guidelines. Without appropriate use of the PPE, you are actually increasing the chance of spreading the infectious organism. They also reported that patients experienced greater dissatisfaction with their treatment, had less documented care, and experienced more preventable outcomes when on isolation precautions. Therefore, when patients are placed on isolation precautions, it is imperative that the healthcare team try to ensure patient comfort and counteract these potential adverse effects.